Hi, my name is Dave Silver from Dave Silver Insurance. I've been specializing in Medicare health insurance options for the past 15 years. My motto is get the facts. Now, I know that you're aging into Medicare and you're getting hit from every different direction. You're getting mailers from different companies, people knocking on your door, getting phone calls. My job is to just give you the facts and let you make the best decision for yourself, okay, and clear away all the confusion. So what 50% of people do when they go on Medicare is they opt to purchase a Medicare supplement policy. So they stay on straight Medicare, then they buy a supplement to pick up the 20% that Medicare doesn't cover you for, and then they also buy a standalone Part D prescription drug plan. Now, the reason why people go with a supplement is that they can see any doctor that accepts Medicare. Medicare is the train, the supplement is the caboose. If Medicare pays, your supplement pays. If the doctors accept Medicare, they accept your supplement. It's irrelevant the name of the company. As long as they accept Medicare, they're going to accept your supplement. So people that go with supplement policies, they don't mind paying a monthly premium for the supplement. They want peace of mind that they can see who they want, wherever they want, in whatever state they're in. Okay, and they do not have to worry about networks or any large medical bills. Now remember, when you go on Medicare, Part A is generally zero, because you've already paid into it for all the years that you worked. Part B has a monthly premium at minimum of $148.50. Your supplement would be an additional premium to Part B, and your drug plan would be an additional premium as well. So you're going to pay that monthly premium whether you get sick or not. That premium is automatic every month, just like other insurance. Okay, but when you have a supplement, the people that go with the supplement, rather, are people who want peace of mind, knowing that they can see who they want, wherever they want, whatever state they want, and they don't have to worry about any large medical bills. Okay, that's the value of a supplement buyer. When you go with a supplement, you also have to purchase a standalone Part D prescription drug plan. There's roughly 30 plans available to residents of Florida. There's only one that's your best option. That's the one with the lowest overall cost, premium plus cost of medicine. What's going to dictate that? The medicine that you take and the pharmacy that you go to. That's going to dictate what your best option is. So when it comes to supplemental coverage and when it comes to prescription drug coverage, you don't want to overspend. I got a little bit ahead of myself. When healthcare reform passed back in 2010, they standardized all the Medicare supplement plan letters A through N. So let's say, for example, you want to go with Plan G. Every company that offers a Plan G in Florida offers the same exact coverage. The only difference is the monthly premium. So make sure that you don't overspend on your Medicare supplement policy. So just to reiterate, you go with a supplement, you have Medicare A, B, you're paying $148.50 for, the premium for the supplement, and the premium for the drug plan. You have peace of mind knowing you can see who you want, wherever you want. You're going to eliminate any large medical bills, but you're going to pay a monthly premium whether you get sick or not. Your other option, too, is what's called a Medicare Advantage plan. Now, Medicare Advantage plans, number one, are not supplement policies. These are privatized Medicare health plans. So a Medicare Advantage plan is defined as a health plan option that is funded by Medicare but administered by a private company. So the federal government is sending a premium payment to a private company of your choice, and that private company is administering or taking over your Medicare. It's not a permanent replacement, but for as long as you want to receive the benefits of that plan in essence is your Medicare. You could take your red, white, and blue Medicare card and put it in a safe spot where you keep other important documents. Now, about 30 to 35% approximately of people that are on Medicare have an Advantage plan. The reason being, and why these plans are as popular as they are, is these plans have little or no premium, and most of the plans in Florida have zero premium. The copays for services are affordable and predictable. Meaning before you sign up for the plan, you have an idea of what things are going to cost you, like going to your primary care doctor. If you get hospitalized, you have to see a specialist. If you have to get an MRI, etc. Okay? These plans are going to give you a lot of extra benefits that you don't get with original Medicare. You'll get prescription drug coverage. Some will give you dental, vision, hearing, the silver sneakers, over-the-counter medicine benefits, etc. The plans are very, very benefit rich, okay? Now, there's two types of Advantage plans. There's HMOs and there's PPOs. With an HMO plan, you have to select a primary care doctor, and that primary care doctor quarterbacks your care, meaning you have to go back to see him or her to get referrals to see specialists. If you go with, and there is no out-of-network benefit. The only time you're covered really out-of-network with an HMO is if it's an emergency or an urgent care situation. Your other option, and what my experience is most of the clients that I work with are people who want to go with a PPO because they don't want to deal with referrals. So they choose to go with a PPO. With a PPO, you do not need referrals to see specialists. You're covered both in and out of network. In network will be one price, out of network you'll still be covered, but you will pay more. It'll be a higher price, but you're still covered. So PPOs are going to give you more flexibility in terms of accessing care. So because you're not going to need the referrals. I know people who don't even have a primary care doctor under a PPO because they don't need referrals to see them. They have their specialists and that's who they see. So they don't need a primary care doctor to coordinate their care. I think, I don't know if that's a good idea or not. Having a primary care doctor is always a good thing. So, but you don't need the primary care doctor under PPO to get a referral. It's not required. But Advantage plans, unlike supplements, are network driven, meaning doctors take them and doctors don't. So the kind of person that goes with an Advantage plan are people who don't want to pay a monthly premium or people who can't afford a monthly premium. The people that go with a supplement are people who want peace of mind. They don't want to deal with networks. They want to see who they want wherever they want, and they pay a premium for that, and they see value in that. The Medicare Advantage buyer is somebody who doesn't want to pay a monthly premium, who can't afford a monthly premium. Now, there's an important rule under Medicare. If you're aging into Medicare and your first choice of coverage under Medicare is an Advantage plan, you do have a 1-year free look period. Let me say that again, a 365-day free look period. If at any time during the first 365 days you decide that the Advantage plan is not a good fit for you, you could call a broker or an agent and you get a special election to sign up for a drug plan. That would put you back on original Medicare because you can't have a drug plan and an Advantage plan at the same time. Or you can't have a standalone drug plan and an Advantage plan at the same time. That will put you back on original Medicare, and then you could get a supplement to start the first of the next month with no medical underwriting. So you do have a 1-year free look period to give the Advantage plan a test drive if you're unsure which way to go, okay? But when you choose an Advantage plan, you have to make sure, just like with drug coverage, like what's going to dictate your best Advantage plan is the doctors that you want to see or the doctors that you want to have access to and the medicines that you take. Because remember, your Advantage plan includes drug coverage. So your doctors have to accept it. Even if you have a PPO, you want your doctors to be in network because you want to keep your costs down. And your drugs have to be covered because if they're not, it could be problematic. So a lot of times when I speak with people who choose Advantage plans, they get so caught up in the extra benefits that they lose sight of the fact that these are health plans first. These are not benefit plans. The only time the extra benefits should really come into play is if their doctors accept the coverage and their medicines are covered affordably. Then the extra benefits, in my opinion, could be a tiebreaker between a couple of different options. But typically speaking, it's going to be what's going to determine your best option under Medicare Advantage, and it's going to be different for everybody. Is going to be whether you want to deal with referrals or not, who your doctors are, and what your medicines are. That's going to dictate what your best options. So let me reiterate. I just thrown a lot of information at you, and I have a tendency to talk fast, so I'm going to go over it one more time. Your Medicare supplement buyer is somebody who wants peace of mind, knowing that they can see who they want, wherever they want, whatever state they want. There are no network restrictions. You're going to pay a monthly premium for that coverage. And the supplement buyers see value in that. With supplements, you don't have to, but it's obviously a great idea to purchase a standalone Part D prescription drug plan. What's going to dictate what your best drug plan is? The one with the lowest overall cost. Premium plus cost of medicine. It's just not premium by itself. the lowest cost drug plan could be your most expensive option, and the most expensive drug plan from a premium standpoint could be your least expensive option. So that's just the way that works. Just remember, with Medicare supplements, all the coverages are standardized based on plan letter, meaning all the companies offer the same exact coverage based on plan letter. The only difference is the monthly premium. So make sure you don't underspend on the supplement. Make sure you don't overspend on the prescription drug plan. If you choose to go the Advantage route, you're not going to pay a monthly premium. The co-pays for services are affordable and predictable, and these plans are loaded with extra benefits that you don't get with original Medicare. Under an Advantage plan, you're going to pay as you go. You're not going to prepay the insurance company like you would under a Medicare supplement policy. The Advantage buyer is somebody who doesn't want to pay a monthly premium or can't afford a monthly premium, but they don't want to pay per month, okay? If you choose an Advantage plan, you want to choose a plan that your doctors accept in common. You want to make sure that your drugs are covered affordably. If both of those things are a match, then the extra benefits are a tiebreaker between, a few different companies if they all become options for you. Now, my name is Dave Silver. You could reach me at my office at area code 941-907-2879. You could also try me on my mobile at 813-417-2716. You could always reach me at info@davesilverinsurance.com. And I'm available to answer your questions 7 days a week, 365 days a year, from 8 in the morning to 8 at night. Look forward to hearing from you.